Good morning, everybody. Thanks for joining us this morning for such an important purpose. This year, as we celebrate the season, dozens of DuPage County families will have an empty place at the table where a loved one should be seated. These families lost husbands, wives, daughters, sons, and grandchildren to drug overdoses involving heroin and opiate painkillers over the past 2 years. The pain is real. Every family will see it when they look to that empty chair. Consider the following. In 2015, DuPage County experienced over 51 deaths attributed to heroin and fentanyl. In 2016, we saw a 100% increase in deaths from fentanyl alone, and our county experienced 78 overdose deaths attributed to heroin, fentanyl, or a combination. Certainly, we are not alone. Statistics just released from the U.S. Centers for Disease Control report 2/3 of last year's drug deaths, some 42,000 people, involved opioids. This category of drugs includes heroin, methadone, prescription pain pills like OxyContin, and fentanyl. U.S. health officials tell us this crisis is actually dragging down our nation's life expectancy. And preliminary figures from 2017 show the rising number of deaths continued over this past year. But even these grim statistics do not begin to capture the more widespread misery caused by opioid addiction, the unemployment and other economic hardships, the tearing of the family fabric, and the increased stress on support agencies and other resources in our communities. The sale of prescription opioids in the United States rose fourfold between 1999 and 2010, even though Americans were not reporting more pain. Also, since 1999, prescription opioid deaths have quadrupled as well, and heroin deaths have risen even more. In short, more opioids produced and prescribed fuel this crisis. Well, today we say enough. Together, we county representatives, chairmen, and state's attorneys join together to announce our individual lawsuits against producers of opioid pain medications. To speak specifically to the DuPage lawsuit is DuPage County State's Attorney Bob Berlin.
Thank you, Chairman Cronin, and thank you to everyone here this morning for taking time out of your busy schedules to confront one of the most terrifying affronts to the health, safety, and well-being facing society today. In DuPage County, there were 51 deaths in 2015 attributable to opioids, including heroin, fentanyl, and prescription pills. That number rose to 78 in 2016, and so far this year, in 2017, we have had 81 deaths attributable to opioids. For a county with 933,000 people, these numbers are staggering. Opioid abuse has grown at such an alarming rate the past few years that we can no longer sit idly by while community after community and family after family is ravaged by this indiscriminate killer. The lawsuits filed in DuPage, Kane, Will, and Lake and McHenry counties today are an attempt to hold the manufacturers of these prescription drugs responsible for the enormous healthcare costs, treatment costs, rising crime rates, escalated social issues, and increased loss of productivity in the workplace incurred by each of these 5 counties. The actions alleged in these complaints cost the plaintiffs, who are in reality Illinois taxpayers, millions of dollars, and that cost continues to rise. The complaints filed this morning allege that for more than 20 years, the defendants developed and executed a coordinated, sophisticated, and highly deceptive marketing campaign for opioid drugs that harkens back to the deceptive and illegal practices the tobacco industry used. The defendants, individually and collectively, knowing that long-term opioid use causes addiction, misrepresented the dangers of long-term opioid use, to physicians, pharmacists, and patients by engaging in an intentionally deceptive campaign to minimize the risks of and to encourage long-term opioid use so they could make billions in profits as they created an epidemic of addiction in DuPage County and across the United States. The defendant's conduct has so severely impacted public health on every geographic and demographic level that the public nuisance perpetrated by the defendants has been referred to as a crisis. The desire to save lives is what brings us here together today. It is our sincere hope that the lawsuits filed this morning will not only prevent more deaths, but will begin the healing process and allow DuPage County to recoup a portion of the losses incurred fighting this deadly epidemic. Now I would like to introduce Kane County State's Attorney Joe McMahon.
Thank you, Bob, and good morning, everybody. Over the last 6 years, 257 people in Kane County have died from opiate use. That's more than all of the gang and domestic violence murders and reckless homicides combined over that same time period. My partners in public health, our coroner Rob Russell and Barb Jeffers, the director of our health department, have confirmed 52 opiate deaths this year alone. And over the next 10 days, that number is expected to rise by as many as 14 as we receive final toxicology test results over the next couple of weeks. As we've said in this lawsuit that we filed this morning, last year the U.S. Centers for Disease Control announced that opioids, primarily prescription pain relievers, and heroin are the main drugs associated with overdose deaths. These are the same opioid painkillers that the pharmaceutical companies named in this lawsuit today aggressively marketed to doctors while minimizing their safety and addiction risks. We now know how misleading these claims have been. They are part of a chain of events that have led some people to illegal street heroin, dramatically broadened the market for heroin, and even developed a demand for dangerous synthetic drugs like fentanyl and carfentanil. Very small amounts of these synthetic drugs are deadly not just to the users, but also to police, paramedics, nurses, and other first responders who rush to these people who are experiencing a deadly overdose in their greatest moment of need. These drugs were developed by pharmaceutical companies for cancer patients and short-term use for post-surgical pain. Doctors, believing the marketing campaigns that the drugs were safe, prescribed them to their patients for longer-term use in non-cancer caused pain. In many cases, they created drug addicts. It is outrageous that so many people have died because of a prescription drug that for years was marketed as safe. These deaths and addictions illustrate that heroin use in our nation, across the region of Northeast Illinois, and specifically in Kane County, is at disastrous levels. Opioid addiction affects every resident in Kane County. Opioid addiction translates into higher health care costs, higher crime rates, more complex social issues, and lower productivity in the workplace. It has destroyed lives, and it tears families apart. It has created a debt that is being paid by our neighbors, our families, and our friends every single day. These increased costs are being borne by small businesses, by our school districts, by law enforcement agencies, by our partners in public health, and ultimately by the taxpayers of Kane County. And it's time that everyone in the supply chain, from manufacturers to distributors to the salespeople who have pushed this poison into our community, are held accountable. The drug industry put profits before people, deliberately misleading trusted doctors who sought to help their patients manage pain. And this lawsuit fulfills our responsibility to hold those who misled our community about the addictiveness of opioids financially accountable, just like we hold street dealers accountable for their role in the heroin trade in our community. Jim Glasgow, the State's Attorney of Will County, is now going to join you. Thank you.
Thank you, Joe. I'm in my 6th term as State's Attorney in Will County, and I've seen a lot of transitions. In 2000, we opened our drug court for the first time, and we've seen a transition from cocaine to opioids. We had 80% cocaine, 20% opioids in the beginning, and now that's flipped. It's 80% opioids and 20% cocaine. Since 2006, we've seen the number of fatalities from opioid overdoses go up tenfold. We had 10 in 2006, we're over 100 now. And that's with everything that we've been doing, going out into the community and speaking about the evils of this poison. And when someone is addicted to an opioid, their rational thought processes come undone. And these manufacturers know this, these pharmaceutical companies know this. They know it's an addiction that you cannot save yourself from. I've talked to countless heroin addicts in our drug court, and one in particular stands out. This young man has got a great job in the computer industry right now, but he told me he would be dead without our drug court. He could not control his own behavior. It took him 3 months in the county jail before the fog lifted and he remembered who he was and even cared whether he lived or died. Unfortunately, we can't arrest everyone who is a drug addict and dry them out for 3 months. And a lot of the treatments are too quick and they don't work, and as soon as they come out the door, they're looking for their next fix. And because of the tremendous supply in Chicago of heroin, someone who gets addicted to the pharmaceuticals that are in the medicine cabinet at home, when those run out, then they transition. And again, the pharmaceutical companies know this, and they know how deadly the heroin on the street is today. And that's why we've had so many overdoses. It's 10 times more potent than it was back in the old days, when you would see somebody in a New York tenement tying off with a rubber hose. So we've got, this lawsuit is long overdue. In 2007, the Purdue company was fined $635 million by the Food and Drug Administration because they withheld the studies that they had that showed how addictive OxyContin was. They paid that $635 million like it was coffee money. So the profits are obscene, and that's what's driving this. The overproduction of these opioids has been publicized for years, but Congress hasn't been able to do anything to stop it. I had a surgery recently, and I was given 30 pills. I didn't take any of them. I didn't need them. I took Tylenol. So it's become the norm for these overprescriptions to be done, and it's fueled by the manufacturers who are putting the supply out. But again, they're not just responsible for the opioids that they're producing. They know that the transition is to heroin, and they know how vile it is out on the street today. And that young man will stay with me for a long time, because this is a kid who will probably live an incredibly productive life and do a lot of positive things for society, and he would have been dead had he not been arrested for the possession of heroin. So I'm hopeful that we'll be successful here. These causes of action, they're all legitimate, and we hope that we're very confident in the law firms that we brought forward here. And it was important to get law firms of this stature to do this, to have any success in federal court and state court. So again, this lawsuit is long overdue, and I'm glad that we were able to all come together, the major counties here in northern Illinois. And Patrick Kenneally is here from McHenry County, and he'll be talking to you next.
We in McHenry County have lost so much over the last several years due to the opioid crisis, and this affliction is still ongoing. On average, a member of our community dies about once every 5 days to an opioid-related death, and that's up about 300% since 2005. On most days, one of our hospitals is caring for a newly born infant in a NICU who is withdrawing from the opioids ingested by his or her mother. I think what's important to understand about this industry-grown crisis is that it affects everybody. No family, regardless of their resources, stability, the affection that they may have shown one another, is immune from falling prey to opioid addiction. No person, regardless of their accomplishments, their wealth, their support network, is beyond the reach of opioid abuse. I can't tell you how many opioid abusers in McHenry County start their story with, I came from a good family. I did well in school. I had a good job. Then I got hurt. Then I got sick, went to the doctor, and then they end their story with, I watched my friends die. I caused my family untold pain. I began committing crimes to support my habit. I lived day to day in and out of jails and prisons, and I regard it as a miracle that I'm still alive today. Like any ill-gotten profit, in the short term, there's an exacting cost to be paid in the long term. And in McHenry County, that cost is being paid by those people in a way that's not easily quantified. And that's the lives and the health of our residents and the misery of those whose loved ones have suffered or continue to suffer from addiction. But it's also the enormous civic costs that we as a county have faced as a result of and as part of our ongoing efforts to alleviate the catastrophic harm that has been done. And these are costs that are primarily going to be borne by taxpayers. One of my principal responsibilities as the McHenry County State's Attorney is to hold accountable those persons or entities whose conduct causes others to suffer. This lawsuit is an attempt to do just that. Thank you. And up next is Mike Nierheim, who's the Lake County State's Attorney.
Morning. I want to thank our sheriff, our coroner, our health department, our county government for their support in this effort. I want to thank my colleagues from the collar counties who have all come together to deal with this issue, and it's important that we all work together because this issue affects every one of our counties. Lake County, like most of the region, has been devastated by this epidemic. This year we've had over 70 opioid-related drug overdose deaths, and that number would be significantly higher had it not been for the 296 naloxone saves by our law enforcement officers. As has been said, this is not simply a criminal justice issue. This is a public health crisis that affects all of us. Some of the things that we've done in Lake County to address this epidemic was to start the Lake County Opioid Initiative, which is a 300-member strong collaborative effort aimed at bringing both the public and private sector together to fight the epidemic. Some of the things that have happened recently were supporting legislation like Senate Bill 772, sponsored by Senator Melinda Bush, who's a member of our initiative, which is aimed at reducing doctor shopping by making checking of the prescription monitoring program database mandatory, and other legislation that would limit initial prescriptions for opioid medication. We also have a text-to-tip program which allows youth the opportunity to access treatment 24/7 through a crisis line, and we've had over 50,000 texts from young people all over across Lake County reaching out and asking for help and access to treatment via that line. We have a prescription disposal network of 26 police departments in our county that last year collected 13,069 pounds of unused medication. We've done, like many of my colleagues, numerous education forums in high schools and community groups around our county aimed at raising awareness and reducing stigma and prevention. We've recently launched a program called A Way Out, which is a county-wide program which allows anybody struggling with addiction access to treatment through the police without an arrest, and we've had over 300 people enter treatment because of that program. But in spite of all of those efforts, this epidemic continues to grow. Nationally, overdoses have quadrupled since 1999. The economic costs are estimated to be over $500 billion just in 2015. These drugs are projected to kill over 50,000 Americans a year. The source of this crisis is not on street corners, it's in boardrooms. Through the action and the lawsuit that I filed this morning in Lake County, we seek to expose this conduct. We seek to stop these companies from continuing their deceptive and unlawful practices, and we want to hold them accountable for the destruction and devastation that they've caused in our communities. And next, I'd like to welcome the Lake County Board Chairman, Aaron Lawlor.
Thank you, State's Attorney Nierheim. Thank you, Chairman Cronin, for having us here. Bottom line is these companies, Purdue Pharmaceutical among them, have caused more damage than they could ever possibly pay for. And they've left Lake County families, communities, and taxpayers picking up the pieces. They've left community foundations for those that we've lost, like Live for Lolly, led by Chelsea Laliberte, who lost her brother due to a heroin overdose. The Jordan Filler Foundation that lost Jordan to an opioid overdose. As the State's Attorney alluded to, we can't just treat this as a criminal issue. It requires us to take an all-in, all-of-the-above approach. And one of the things I'm most proud of is our prescription drug disposal program. Lake County represents about 5% of our state's population, yet we collected 25% of what was disposed of in unwanted recycled medications. It's so important that we recognize that substance abuse is a behavioral health issue, it is a mental health issue, and it is the greatest moral imperative that our leaders have a calling to answer. Next, I'd like to welcome my colleague and peer in Kane County, Chairman Chris Lauzen.
Thank you very much, Aaron. On behalf of all of our families, I am so grateful for the efforts being made by all of you. Let's see if I can very briefly summarize what we've heard this morning. Once again, our regional leadership, through our county organizations, is united in our purpose of protecting the public health and safety of the people whom we serve. Together, we clearly recognize the threat and damage caused by this opioid epidemic. The impact of opioid addiction affects every resident of Kane County, our region in Illinois, and our country. This translates into higher health care costs, rising crime rates, escalated social issues, and increased losses of productivity in the workplace. The cost, this debt, is being paid by our neighbors, our families, and our friends every single day. The most competent and best legal minds of our counties, the state's attorneys and their allies, are being mobilized to bring suit against the opioid industry for their blatant and continuous campaign to misrepresent the addictive nature of opioids in order to harvest blockbuster billions of dollars of profits and increase exaggerated returns to owners of these companies. For more than 20 years, the defendants developed and executed a coordinated, sophisticated, and highly deceptive marketing campaign for opioid drugs that echoes the deceptive and illegal practices that the tobacco industry used. Defendants, individually and collectively, knowing that long-term opioid use causes addiction, misrepresented the dangers of long-term opioid use to physicians, pharmacists, and patients by engaging in an intentionally deceptive campaign to minimize the risks of and to encourage long-term opioid use, so they could make billions in profits as they created an epidemic of addiction in Kane County, Illinois, and across the United States. It is ultimately important to see that the damage done by this illegal commercial behavior is not only the tragic price paid directly by isolated deaths of children, sisters and brothers, wives and husbands, even grandparents, but the indirect, insidious burden borne by our entire community, by every one of us, every day and every week. Anyone who knows me in my public and private career understands how much I value the business community and how strongly I believe that government should stay out of the way of business progress. But when a company or companies knowingly conspire to create marketing proven to encourage addiction, increase crime, add hundreds of millions of dollars of tax burden, and destroy young lives, it's government's duty and responsibility to take action. You don't need me to repeat the statistics and arguments cited by earlier speakers to know that opioid epidemic is real. Drug manufacturers are a powerful force with billions of dollars and teams of lawyers at their disposal. But the people united through appropriate government action is also a powerful defender of our safety and security. Abraham Lincoln, Illinois' favorite son, is often quoted saying, "America will never be destroyed from outside. If we falter and lose our freedoms, it will be because we destroy ourselves from the inside. As a nation of free men and women, we must live through all time or die by suicide. We stand together today to ensure that we will not be victims to that unnecessary and tragic fate."
We will take questions now, so gentlemen, if you want to come on up.
If I may, I want to recognize Rich Jorgensen is here, our county coroner. Rich, I think, sounded the alarm bell here in DuPage about the tragedy, the deaths, the families. So I want to thank Rich for his commitment to public service. We have a wonderful coalition heroin task force that has been focused on this. I see Karen Ayala is here from our health department. We recognize that this is a public health crisis, as well as a law enforcement, as well as a civil responsibility, liability matter as well. So be happy to answer any questions that you may have. Ted Gregory.
So what responsibility, if any, do physicians have in all this? You guys are going after the drug companies, but the physicians are sort of conduit as well.
It's our contention, and we've alleged in these lawsuits, that the physicians were victims of this fraud, just like everybody else.
They're prescribing, so you're thinking they were defrauded or?
They've been prescribing these medications because they were convinced that the medications were safe. That's what they were told by the drug companies and by agents of the drug companies.
So the site, you're talking, touched on the $635 million fine that Peru paid off. I mean, what's the end goal here? You're not going to shut down the companies. I mean, what's the end goal?
The end goal is to get the drug manufacturers to abate the public nuisance that they've created, and also to compensate all of the counties involved for all of the damages and losses that have been occurred and that are ongoing to this point. As we stand here today, these losses continue to mount.
Is there a dollar figure attached to this?
It's a large amount. I can't give you an exact amount other than to tell you that that amount increases on a day-to-day basis.
Someone here related it to the fight against the tobacco industry. That was a really difficult fight. It's still going on. So how do you see this being able to be adjudicated in the way that you want?
This will be a contested piece of litigation. These issues are being litigated across the country. Some of these lawsuits have been filed in Illinois already by other counties. This group that's here before you this morning is the largest coalition of government bodies that have come together to try to address this, this epidemic and this disastrous kind of influx of poison into our communities. It will be a process. It will take several years, I expect. But the goal is to stem the flow of these drugs into our community and to get the pharmacy industry, the drug manufacturers, to take responsibility and be held financially accountable, and to disgorge the profits that they've earned through these misleading marketing campaigns, not just to the public, but to the physicians, to all of us, while they sit back and collect millions and billions of dollars in profit. So to really answer that as a wrap-up, it'll take a long time. We expect that the litigation will be contested, but we're prepared to see the litigation through to its end to stem the flow of drugs into our community.
Do you see other counties in the state?
I do think there will be other counties in the state. Other counties in the state have already filed suit, and I think other counties across the country will join this litigation as well. I think this is the beginning of a movement. I think, and I'm grateful to all of our colleagues across the region, that we have stepped forward and we have taken the initiative to take on the challenge of a well-funded, financially industry that is going to resist this lawsuit and these allegations aggressively. We represent collectively over 3 million people across the suburban region. And I think as other counties join this fight, that number will grow. And that is a powerful message. That is a powerful group of people who have had enough of seeing their friends and family and coworkers and people that they love die from this incredible epidemic.
So, if I may, I'm sorry. So you're investing a lot of tax dollars in this. I'm assuming it's ought to be paid by taxpayers, right? You're going to fund this legal cost, I'm guessing, at this point, upfront?
The answer is no. Taxpayers will not fund this litigation.
Who's going to fund it?
The relationship that we have with our lawyers, the costs and expenses will be borne by outside counsel. Cost will not be pushed back to the taxpayers of each of our respective counties. There is no cost to the taxpayer. Certainly we'll have an investment of time in collecting information. That's expected with any lawsuit. We anticipate that people will, employees of the county will have to produce information and give depositions at some point, but we're not talking about an additional cost that are going to be borne by the taxpayers. That will not happen, no, sir.
So presumably, do they get a percentage of what they recover for the counties? Is that how?
I can speak for Kane County, and yes, the council that we have partnered with will receive a percentage of any recovery. Yes, sir. For Kane County, it is 25%.
Is that the same for the other counties?
Yes, Jim.
I just wanted to be clear that the ultimate goal, the ultimate belief is that the outcome of these lawsuits will directly result in the reduction in opioid deaths in our communities.
That is the goal. The goal is public safety here, but it's also, because it's a civil lawsuit, as Mr. Berlin mentioned, it's to stop the flow of drugs into our community, and it's to hold these drug manufacturers financially accountable.
That's everything. Thank you, everybody. Mr. Chairman, anything else?
Yeah, I just want to thank everybody. Appreciate all the gentlemen here in law enforcement and state's attorneys. You know, keep in mind that we've been fighting this fight on a lot of different fronts, you know, and so today this represents a new front. Ted Gregory, one question further.
Quick question, sorry, but how confident are you that you'll be successful? Because again, this is a lot of resources. How confident are you?
You have to understand, when you talk about cost to the taxpayers, every day that goes by that we're not pushing this lawsuit, the cost to law enforcement, when you lose your son or daughter to this, you can't put a price on that. So step number one is to drive them back on their heels, okay? They're going to take notice. The general public is going to see your news coverage, and they're going to go, oh, my God, I didn't realize it was that bad. Whenever I talk about this, I talk about Popeye Doyle in French Connection 2. He was the super cop, Eddie Egan, and the French cartel, they kidnapped him. They strapped him to a chair, and they shot him up with heroin, and they owned him. Everyone in this room, it could fall victim to an opioid addiction. I think I can overcome anything. I know from what I've done in this business, I could not overcome an opioid addiction on my own. So this is the most critical health challenge that we've ever faced. Your brain chemistry changes. You're not yourself anymore. I've lost track of the number of kids that I've talked to in drug court who have come up to me and said, I would be dead if it wasn't for this drug court. Thank you so much. you know, that, I don't know how you even put a price on something like that. It's, you know, if I never do another thing in my life, I know that I helped save some of these kids. But that's not enough, because there are still many of, and as was mentioned, if it wasn't for naloxone, our first responders save hundreds and hundreds of kids and adults every year in all of our counties by getting there in time. And we've now spread that out. The police officers are carrying it, and I've got a number of people, employees in my office who carry it. So it's more readily available than it's ever been. But again, we don't have a statistic on how many of those people we saved that went to the hospital and then went right back on their addiction and wound up coming in on the bottom end. I know that's happening. So this stuff is so incredibly deadly, it's hard to imagine that this industry isn't stepping up on its own and self-policing. And maybe if we raise enough hell here, that'll happen. I've gone against a number of big corporations. We were just talking about one in the room back there. It was an issue of federal jurisdiction. And we went at them really hard in the media. And about a week later, they put the federal jurisdiction defense to the side and said, we want to sit down and talk and resolve this. So you guys can help us. We'll be anxious to see how you cover this.
Does anybody have an idea of how much of the heroin problem, the actual heroin problem, is a result of the opioid prescription drugs?
So I was just talking to our health department chair this morning about this, and the latest figures we have is if you are addicted to opiate pain medication, you're 40 times higher risk to use heroin. So it's a significant driver.
But more specifically, when we think about crimes that are related to actual heroin use, and you have some sense of how much of that you would attribute to prescription opioid abuse that leads to the next step?
Sure. So there's a vast majority of drug-related crimes that we look at, and it's not simply drug possession or selling of illegal drugs. It's your burglaries, your thefts, car burglaries, criminal damage to property, crimes that people that otherwise would probably have no contact with the criminal justice system. These people are committing these crimes to feed their addiction. Thank you.